Yeah, so good morning. We'll continue with the classes which I'm supposed to take for you. So today we'll talk about contraception. Okay, so you have three classes on contraception, but I think the next Thursday will be your fourth day. Yeah, so the classes have been suspended on that day. Okay, so you're directly supposed to go to the ground, I think. So I'll try to finish it in two classes. Uh, so when we talk about contraception, what do you understand by contraception? Prevention of pregnancy. Okay. I'm sorry. From a PDF. Yeah. So the term contraception is nothing but it includes all the measures, either temporary or permanent, to prevent pregnancy. Okay. So this pregnancy occurring result of unprotected intercourse. Okay, so that is basically contraception. Now, when you talk about contraception to somebody, it has to be under certain scenarios. Okay, maybe the patient wants a spacing of pregnancy, or she may want a permanent method of contraception. Okay, so whenever you talk about contraception to any patient, it has to be depending upon what her needs are. Okay. So before we discuss in detail about the contraception, so I would want to know from you what is an ideal contraceptive. I've written a few points here, but what according to you would be a most ideal contraceptive? Safe, yes, very good. Safety. Okay, safety both for the female as well as her partner, and also in case there happens a pregnancy. Okay, it should not have or have very minimal effects on the pregnancy which is conceived. Okay, so one thing is it should be safe. Yeah, so safe is already there. So easy to use and it should be safe. What else? Yes, it should be acceptable socially. Okay, that means it should not interfere with her day-to-day life or her way of living or her culture. Okay, why are you late, ma'am? Every time I see today I started the class at 8:05. Every time you have to tell the same thing. Why are you late? You tell me. Why are you late? Huh? You please wait out. It is very clear from my side. If you don't enter the class before 8, then you're out. Okay? Please walk out. Don't disturb the class when it's going on. Should have some etiquette as students. Okay? Yeah. So it has to be culturally acceptable to her family, her partner, as well as herself. Okay? So what else? Yes, it should be an economical type of contraceptive. It should not have a very huge financial burden, because all the people in the country or wherever in the society are not of the same economic class. Okay, so whatever contraceptive the woman chooses, it has to be an economical contraceptive, right? Because usually contraceptives are used for at least some period of time. Okay, whether it is OCPs or copper T, whatever it is, they are going to be used over a period of time for few months or years. Okay, so it has to be a economical contraceptive. It should not have a very huge financial burden on the family, right? What else? Yes, it should be easy to use. Okay, even though the contraceptive fulfills all the criteria, but if it is a very cumbersome contraceptive to use, so the acceptability will not be good. Okay, so the contraceptive method, what you are going to advise, should be a easy to use one, right? What else? Yes, the side effects which it has, okay, on the woman or her partner has to be very minimal, or it should be almost nil, right? Okay, then yes. So in case the woman is using a temporary method of contraception, the fertility should be reversible after its use. Okay. So it should not have any long-term effect on the fertility, especially the reversible or the temporary contraceptive method. Okay. So the fertility should be reversible once the use is discontinued. Right. What else? What else? Do we have so many doctors or healthcare workers to go on supervising these women who are using contraceptives? Yes. So the need of supervision by the healthcare personnel should be minimal or negligible. Okay? It's not that once you advise a contraception, she is going to be off the medical follow-up, but the need for medical follow-up or supervision, okay, unlike in any other condition, should be very, very minimal. Okay? So maybe once you see her at the beginning of initiation of the contraceptive and somewhere in between. Okay? And she has to come at a time when she wants a reversal of fertility. Okay? So the follow-up or the supervision which she requires during the use of that contraceptive method should be minimal. Right? What else? What else? I've written there. It should be highly effective. Means it should try to protect from pregnancy 100%. Okay? It should be a highly effective contraceptive. Right? And after its use or during its use, it should have some non-contraceptive benefits on the women, okay, or the person who's using it. Like maybe it can correct the anemia which is there, which is very, very prevalent in our country, okay, or correction of some other condition or prevention of some other condition. Like maybe if you use a contraceptive, there is a protection against some carcinomas or cancer, you know. So it should have some non-contraceptive benefits on the woman or on the person who's using it. It could even be the male partner. Okay. So after you look at all this, so what is the conclusion? There is no ideal contraceptive. Okay. So no contraceptive available in the market or available in the country is 100% effective, 100% safe. Okay. So it is going to have some amount of effect on the person who is going to use it. Okay. So what should you do before initiation of contraceptive? The most important thing is counseling. Okay? You need to talk to the patient or the person who has come asking for a contraceptive in detail about each of the methods. Okay? So now why is it important to counsel for contraception? Why do you think it is important, especially in the postnatal wards or especially in gynecology? Even in the pediatric ward, whenever you are seeing babies or mothers who are there with the infants or the toddlers there, you need to talk to the mother about the contraception. Why is it important to talk? Yes. Yes, very good. Yes. So the most important thing is there's a lot of stigma which is associated with use of contraception. Okay. So that is one thing. And the benefits of contraception outweigh the risk what the woman has to her life. Okay. Out of a unwanted pregnancy. Okay. Because you know that during pregnancy there can be so many complications. Okay. And in an effort to get rid of that unwanted pregnancy, there might be a increased risk of septic abortions, right? So they may not come to the healthcare workers. They might use something which is not safe to get rid of that pregnancy or to undergo the process of abortion. Okay. So why is it important for contraceptive counseling is the benefits of counseling for a contraception clearly outweigh the risk of the unwanted pregnancies. Okay. Is it clear? So that is why. And the second thing is the stigma, as she said. Okay, the stigma which is associated with use of certain contraceptives. That has to be looked into. Right? Okay. So what you have to counsel is no single method is universally acceptable. Okay. So whenever you start the counseling of a patient, you need to ask what are their demands or what are their expectations from that contraceptive. Okay. Do they want it for few months, few years, or they want a permanent method of sterilization? Is she fit to use that particular method? Okay, because not all contraceptives are safe in all women. Okay, so is it safe for her to use those contraceptives? So all these have to be talked to the patient, and the couple should make a informed choice. That means they should know all the contraceptive methods which are available or they are eligible to use and then after knowing the pros and cons of that particular contraceptive, they should make an informed choice to use it. Okay, is it clear? Yeah, so that's about the counseling part. So the method which is opted for contraceptive counseling is called as a cafeteria approach. Okay, it is called as a cafeteria approach. What does that mean? So when you go to a hotel, what do you do? Or when you go to a cafe, what do you do? You have a tea toast here. So he has displayed all what is available. Okay, and you choose what you want. Okay, and then the job of the counselor or the person who is going to give or advise on that contraceptive is to see whether you are eligible to use that particular contraceptive. Okay, so that is called as the cafeteria approach. That means all the methods whichever are available or whichever the woman is eligible to use are informed to the patient. Okay, including the side effects, the follow-up which is required, okay, and the common conditions where it should not be used or what can happen in the due course of usage of that particular contraceptive. Okay, so that approach is called as the cafeteria approach. Right? Understood? So what do you understand by contraception? It is a method to, either temporary or permanent method to prevent occurrence of a pregnancy. Okay, and who should be counseled about the contraception? I told you it is all the eligible couples, okay, who are likely to get pregnant. And why it is important to counsel for contraception is, yes, the benefits of the contraception are going to outweigh the risk. Okay, right. And the method of counseling is called as the cafeteria approach. Right? Okay. Now, whom do we counsel? Whom do we counsel for contraception? You have almost the entire spectrum, right from adolescents to women who have completed their families, okay, or couples who have completed their families. Okay. So we take advantage of few settings during the course of the woman's reproductive life to counsel about contraception. Okay, and what we found was the postpartum period. That is the period immediately after delivery of the baby. The women who are there in the postnatal ward, they are the ones who are most receptive to what you are going to tell. Okay, so the first population which you have to target is the postpartum women. Okay, it could be after a cesarean delivery or it could be after a vaginal delivery. So in the postnatal period, it is very, very important to include use the counseling of contraception as a very important part of the postnatal care. I think in the last class I told you, right? So one of the important advices what you should give to the woman is regarding the family planning method. Okay, is it clear? Yeah. So we take advantage of the postpartum period. Okay, and this contraceptive counseling should not just be restricted to the postpartum period, but it should begin from the antenatal period itself. Okay, we have some primees who do not want a subsequent pregnancy quickly. So all this awareness about contraception should start from the antenatal period. Okay, that is again a very, very important component of the antenatal care, where a family planning counseling is done to the women. Okay, right. So postpartum period. So what is the most ideal contraceptive which is advised in the postpartum period? Yes, after a vaginal delivery, we usually counsel them for a property insertion. Okay, either immediately after delivery or after 6 weeks. That is after the end of puerperium. Okay, and after 6 months in a patient who has undergone cesarean section. Okay, so 6 weeks is for vaginal delivery and 6 months is for post-cesarean section. Okay, so ideally we counsel them for property. Then another very important group is the post-abortal group. These are the women who have had a miscarriage either because of some problems in the baby, okay, or it can be a spontaneous miscarriage, or these are the ones who have ended up with abortion for an unwanted pregnancy. So they know what they have gone through. Okay, the economical burden as well as the emotional burden which comes with miscarriages. Okay, so they are again very very receptible to contraception. Okay, so these are the women again which we have to target. Okay, it's not ideally only the woman, but the couple, both the husband and the wife have to be counseled for contraception. Okay, then comes the interval group, that is the ones who have delivered and they do not want a subsequent pregnancy so early. So after the end of puerperium, okay, they happen to come to a healthcare facility for some other reason, maybe just for a blood pressure checkup or for a blood glucose checkup, or they might be relatives of some other patient who is admitted. Okay, so such patients have to be counseled for an interval spacing. Okay, so they come under the category of uh, uh, interval spacing of pregnancy. Okay, so that comes under the interval. Then another very important group which we have to target is the newly married. Okay, again they are the ones who are receptive to your contraceptive counseling. They are in need of a contraception because most of them are educated now, right? They are working, so they need some amount of contraceptive. Okay, so newly married, and then again now adolescent contraception. Okay, it has become a very important part of counseling in contraception. Okay, so even for the adolescents, you have to counsel for contraception. Okay, and emphasis has to be laid that though we advise contraceptive counseling in adolescents, it does not prevent completely against sexually transmitted diseases. Okay, so that has to be emphasized there. Okay, so that is about whom do we counsel. Now I told you that there is no effective contraceptive, right? So when we counsel these particular women and tell them about the various methods of contraception which are available for them, you also need to tell them how effective each contraceptive is. Okay, and the contraceptive effectiveness is said, or it is rated by the failure rate of that particular method. Okay, it is rated by the failure rate of that particular method, and the calculation of the failure rate is the number of accidental pregnancies which have happened during the course of that use of that particular contraceptive divided by the number of patients observed and the months of use, and this whole thing is multiplied with 1200. Okay, and it is expressed as 100 woman years. So a year has 12 months. Okay, and it is multiplied by 100. So the way to express this failure rate is as 100 woman years. Okay, suppose for example a barrier method like a condom, it has got the highest failure rate. Okay, among all the temporary methods, the effectiveness of a condom or the failure rate of the condom is as high as 8 to 10%. So there is a risk of every 8 to 10 women becoming pregnant. Okay, if they use it continuously for 1 year. Okay, that is called as Pearl Index. This is also called as the Pearl Index. Okay, so that is nothing but the contraceptive effectiveness or the failure rate of that particular contraceptive. Okay, so whenever we advise a particular method of contraception, we have to take care and also tell that there is a failure rate associated with each of the methods. Right? Is it clear? Okay. So it is expressed as 100 woman years. So 8 to 10 per 100 woman years. That is the failure rate of a condom. Okay, it's like that. Is it clear? Okay. Now, how do we classify these contraceptives? I told you it can be classified as a temporary method where basically a spacing between pregnancies is required, or especially in the newly married where they want to delay their first pregnancy itself. Okay, so you have temporary methods which are usually used to space birth or delay the occurrence of pregnancy, and then there are some called as the permanent methods. Okay, where we counsel the woman or the husband to undergo voluntary sterilization so that there is a fault in the reproductive mechanism. Okay, so there is a voluntary sterilization which we do. Okay, either by doing a tubectomy or vasectomy in the male. Okay, so the way of classifying the contraceptive is the temporary and the permanent methods. Okay, yeah, yeah. So these are the various temporary methods which are available for contraception. Okay, the most commonly used are the barrier methods. Okay, in the form of condoms, it could be female diaphragms or also called as the female condoms, and certain spermicides. Okay, so these spermicides are available either in the form of a gel, okay, or in the form of a sponge. So it's available as a tablet which is inserted vaginally, and then because of the secretions and because of the moisture which is there in the vagina, it becomes a sponge. Okay, and it contains a spermicide. Okay, so these are the barrier methods. And then you have the natural method. That is, it's one of the nature's way of taking care of prevention of an immediate pregnancy. And the most commonly used natural methods are the LAM, that is called as the lactational amenorrhea method. That is, immediately after delivery, when the woman is breastfeeding the baby, there is an inhibition of ovulation and there is a cessation of menses temporarily. So there is a secondary amenorrhea which happens after delivery. Okay, because of the high levels of prolactin and oxytocin, there is going to be a inhibition of ovulation there. Okay, so that method is called as the LAM method. Again, it's a very, very least effective method of contraception. Okay, then you have something called as the calendar method. Okay, calendar method is nothing but it is one of the ways to predict the days of ovulation. Okay, and this is useful when the woman's cycles are fixed. Okay, suppose a lady is menstruating every 28 to 30 days, so she can predict her days of ovulation which happen in the mid-cycle. Okay, so excluding those days, she can have intercourse unprotected on the other days. This again is a method which has got a very high failure rate because ovulation can occur anytime during the menses, right? In some women, okay? Usually it is predictable, but in some women it can occur anytime, okay? So this is again a method which is a natural way to prevent pregnancy. Then you have IUCDs. They are nothing but the intrauterine contraceptive devices, IUCDs, okay? So here you have the ones which contain copper only, okay, and the ones which are hormonal impregnated along with the copper, okay, that is called as levonorgestrel intrauterine system, LNGIUS, that is called as a levonorgestrel intrauterine system, okay. So you have property or IUCDs which may contain only copper, okay, or they may be impregnated with a hormone, right? Then you have hormonal contraceptives, okay, that is nothing but the oral contraceptive pills, okay, which contain a combination of both estrogen and progesterone, that is the OCPs, or also called as the combined OCPs, where you have both estrogen and progesterone, or there might be only progesterone only pills. That means there is only progesterone which is there in that pill, okay, or it could be implants like a Norplant where the subcutaneously or subdermally there are certain devices, small needle-like inserts which are placed and they provide contraception, okay, by release of low levels of progesterone throughout the cycle. They are called as implantable devices or implantable steroidal contraceptives. Then you also have injectables where there is a long-acting progesterone which is given as a depot preparation. So it's an oil-based preparation and there's a slow release from the intramuscular injection for a period of 3 to 4 months. Okay, so that's called as a injectable contraceptive. Then there is also vaginal rings which are available. Okay, similar to a pessary what is put in prolapse, you have small vaginal rings which are available, which are inserted vaginally, and this is again impregnated with the progesterone. Okay, so that maintains the contraceptive thing there. Then there are transdermal patches which are available. Okay, so these again are hormonal contraceptives where there is an absorption of the progesterone. So it's made in such a way that it can be absorbed through the skin and it provides contraception. Okay, so these are all the temporary methods of contraception which are available. Is it clear? Okay. Which are most? It is IUCD, unfortunately. The ones which are actually very effective in the postnatal period, people don't want an IUCD insertion because they feel the fertility will not be reversed. They feel something is being done to the uterus, unfortunately. But that's a very, very effective way of preventing pregnancy. Okay. Then you have a permanent method. Okay. So I told you, we classify them as temporary and permanent. Permanent are the ones where you can sterilize the female or sterilize the male. Okay. And mind you, there is no problem with the sexual activity after undergoing these procedures. So it does not hamper sexual activity. It only prevents occurrence of pregnancy. Okay. So tubectomy is the most commonly employed permanent sterilization method. Okay, where there is a ligation on both the sides, which is done for the fallopian tube, because fallopian tubes are the place where the fertilization actually occurs, isn't it? You all know the fertilization occurs in the fallopian tube. So we iatrogenically are going to block the fallopian tubes on both the sides by ligating them. Okay, that is called as a tubectomy, and this is one of the most commonly performed sterilization procedure in India and also worldwide. Okay, then the same procedure can be done by a minimally invasive method which is called as the laparoscopic sterilization. Okay, or also nowadays we call it as a keyhole sterilization. Okay, so it's called as the laparoscopic sterilization, where the approach to the tubes is by using a laparoscope rather than opening up the abdomen, like what we do in tubectomy. Okay, tubectomy is we incise and then access the tube. It's similar to what surgery we do, but laparoscopy is nothing but you're going to do it under a laparoscopic guidance. Is it clear? So that's called as the laparoscopic sterilization. Then in the males, the vas deferens is clamped and ligated. Okay, so that is called as the no scalpel vasectomy. Okay, so there is a ligation of the vas deferens. So there is no way that the sperms are going to reach the epididymis and then the vas deferens, and from there it's going to be ejaculated, right? So it is stopped at that level. It does not hamper the male fertility. Okay, that means usually these are irreversible. The non-scalpel vasectomy are irreversible, but there is no problem with the sexual function. Okay, that has to be emphasized. That is the permanent method of sterilization. Clear? Any doubts in today's class? I have not put too many things today just to sensitize you people about what is contraception, how you should be going about the use of contraception, counseling, as well as the different methods. I'll discuss in a little in detail about the barriers as well as the IUCD, and in another class we will take about the permanent sterilization method in short. The rest will be taught to you in the subsequent years when you come to final year. Okay? Any doubts? No? You understood what is contraception? Yes, it is accepted, but it requires a lot of motivation. Another very important thing which I had to tell you today is about the emergency contraception. Okay, so this is in women or in couples who have delayed their decision in adopting a particular method of contraception, or there has been a inadvertent or an unwanted act of coitus where there is a risk of pregnancy. Okay, so it is also called as a post-coital contraception. Okay, So what you must know about this is, it is not a very effective method of contraception because we don't know when the ovulation has occurred. So post-coital contraception or emergency contraception is when you are actually able to predict the ovulation when it has occurred. Okay, but in case the woman has irregular cycles, okay, or she has had multiple acts of coitus in the past, so this method will not be effective. Is it clear? So it is usually for a single act of coitus, especially during the ovulatory phase of the cycle. Okay, so what you must know about this is, the contraceptive has to be initiated within the first 24 hours. The first pill has to be taken within the first 24 hours of the act of coitus, and the second pill or the subsequent pills have to be taken within the first 72 hours of the act of coitus. So that means if somebody who has had multiple acts of coitus, you will not be able to predict. So this is not a effective method of contraception. You cannot predict when the ovulation has occurred. It only protects against a single act of coitus. Okay, so that has to be remembered. Now what is used as an emergency contraceptive pill is, you can use progesterone only pills. Okay, so a very high level of progesterone is given, which makes the endometrium out of phase, okay, for the implantation to occur. So normally what happens, the estrogen and the progesterone, they are going to prime the endometrium so that the pregnancy is supported in case there is a pregnancy which occurs. But by giving a very high level of progesterone, the endometrium is made out of phase, okay, so it becomes thinned out, so the implantation doesn't occur in the uterus. Okay, so that is one of the ways of emergency contraception, how it acts. And the second thing is, you can also use an emergency insertion of a contraceptive device, intrauterine contraceptive device. Okay, so within the first 24 hours of the act of coitus, if a property is inserted, then there can be prevention of pregnancy. So use of progesterone or property, both of them provide emergency contraception. Is it clear? Okay, but what is the problem with these? It again does not prevent against sexually transmitted infections, okay, or certain reproductive tract infections like PID, okay, and it does have some effect on the menstrual cycle, okay. The cycle might be delayed or there might be a heavy bleeding, and also it increases the risk of ectopic pregnancy, okay. This emergency contraceptive increases the risk of ectopic pregnancy, where the implantation can occur in the tubes itself because the uterus is unfavorable, the uterine cavity is unfavorable, the implantation can occur in the tubes. Okay, so that is a one very important message which you should take from emergency contraception. So it should not be used frequently. That's what I want to emphasize on. So it is not a very effective method to prevent pregnancy. It usually protects only against a single act of coitus, not multiple. Okay. Then use of progesterone only pills or IUCDs can be used as an emergency contraception, and it does not protect against the sexually transmitted infections or diseases. Okay, like HIV, hepatitis B, syphilis, gonorrhea, they do not protect against those infections. Okay, then another very important point is, it should not be used frequently. Okay, these should not be used frequently because they have long-term implications on the fertility. Right? Is it clear? Okay, that's about the emergency contraception. So any doubts in today's class? You understood something about contraception? Okay. So what is your basic duty as an undergraduate in the postnatal wards? You must read about contraception properly, so that when you see patients in the postnatal ward or in the pediatric ward, you must be able to counsel the mothers, the women who are there, to adopt at least one method of contraception to space the birth. Okay?